Okay, hello everyone. We will be reviewing the cardiovascular system in this video. In announcements, I have shared with you two diagrams, one of the arteries and another of the veins. Use this map as a visual aid when studying blood flow away from the heart and blood flow back into the heart. That's more for your lab portion. So just keep that in mind that is there for you to utilize. Okay, so this is one of the versions right here. This is the diagram of the arteries. And then this is the diagram here for the veins. Okay, so circulatory system versus the cardiovascular system. Circulatory system is going to consist of all circulatory structures within the body. These structures being the blood vessels, which circulate blood, the lymphatic vessels, which circulate lymph fluid and aid in lipid absorption. But we will discuss the lymphatic structures within another unit. So just keep those in mind. And then the cardiovascular system is also going to be included within the circulatory system, as the heart muscles facilitate the contraction of blood and pushing that oxygen and nutrient-rich blood to other structures of the body. The cardiovascular system, on the other hand, is going to focus on the heart and blood vessels only, specifically the anatomy of the heart and how it pumps and circulates blood. For example, on the anatomy side, if you've already reviewed the lab notes for the heart, you'll see how the left ventricle muscle layer is much thicker to that of the right ventricle muscle layer. This difference in anatomy is important because that thick muscle supports the strong contraction needed to push oxygen-rich blood to the remainder of the body. Okay, now let's discuss the pulmonary and systemic circuits. The pulmonary circuit involves the heart and the lungs. This is because the right side of the heart pushes oxygen-poor blood into the lungs for gas exchange. Returning blood from the veins will flow through the superior and inferior vena cava into the right atrium, past the tricuspid valve into the right ventricle, where it will contract, pushing blood into the pulmonary trunk and then into the right and left pulmonary arteries, entering the lung, where it will enter the lungs for gas exchange. The pulmonary circuit is going to begin in the right ventricle. I can usually remember this by thinking, where is the blood before it enters the lungs? Now, some vocabulary words that will be very important for any of the nursing students. If you want to make a good impression during clinicals, it's important that you understand these two terms, perfusion and blood flow. Perfusion is the flow expressed by a given volume or mass of a tissue. It is the flow of blood through the blood vessels to deliver an appropriate amount of oxygen and nutrients to the tissue. Let's take the brain for instance. We need adequate blood flow to our brains to function in day-to-day life. If there is a decrease in blood flow to the brain, then that means there's a decrease in perfusion. That can result in an individual feeling dizzy, having memory issues, or a higher risk of fainting and slurred speech. Now, you've heard me say flow a lot while explaining perfusion. Flow, when talked about the cardiovascular system, is the amount of blood flowing through a blood vessel, tissue, or organ. Proper blood flow is unobstructed, allowing for proper perfusion of tissue so that oxygen and nutrients can be received in that given area. Using a real life example from my life currently, my grandmother has experienced poor blood flow to her right foot due to multiple clogged arteries in that area. This reduction in blood flow has caused pain, discoloration of skin, and swelling. Fortunately, we were able to see a specialist and have a surgical procedure to unclog those arteries. But in extreme cases, amputation may be necessary due to decay of limbs. The systemic circuit is going to pertain to the heart and the body. The left side of the heart supplies oxygen-rich blood to all the organs of the body and begins in the left ventricle. Once blood has been oxygenated, it will come into the left atrium from the right and left pulmonary veins, past the bicuspid valve to the left ventricle, and the left ventricle will contract that oxygen-rich blood to the remainder of the body by pushing it through the ascending aorta when it branches off, and then where it branches off into the other arteries. Again, I like to think to myself, which chamber is the blood in before making its way to the remainder of the body? Okay, now that parallel pathway of blood flow, now the parallel pathway of blood flow just means that blood travels through multiple routes at the same time. Even if one route is down, blood will still reach vital areas. As I had mentioned, my grandmother had reduced blood flow to her right foot due to clogged arteries. If I recall correctly, her surgeon said she was down to one main artery that was delivering a small amount of blood to her foot. The blood vessels branch from larger arteries and veins into smaller capillaries, allowing for tissue to be adequately perfused and to ensure all areas are receiving enough blood flow. Dynamic flow just means that blood flow changes depending on your body's needs. An easy body structure to think of is your legs. When we are running, more blood is being pushed to our leg muscles to adequately remove waste products and carbon dioxide from those cells and ensure enough oxygen and nutrients are entering the muscle cells for proper function. Okay. Now the fetal heart is different from the adult heart. I've added some review videos to the review slide that I highly recommend you check out, as this is part of your lab lecture notes. For this video, I'll only be sticking to certain slides to keep it short. If you have made it this far in the video, send me a message on Canvas naming one of the structures of the fetal heart that is different from that of the adult heart. Okay, now the cardiac cycle. The cardiac cycle is a sequence of contractions and relaxations of the heart as it functions to pump blood through the body. There are 4 stages: atrial systole, atrial diastole, ventricular systole, and ventricular diastole. Systole means to contract, and diastole means to relax. Atrial pertains to the atriums, and ventricular pertains to the ventricles. For the cardiac cycle, it is best to look at which stages are occurring at the same time, which chambers are contracting and relaxing, and which valves are open and closed during each stage. In the next, in this slide right here, or in the next slide, I will show you a study guide I created to use and review. I created to study and review. This study tool is linked within the announcements for you to use. Okay, so atrial systole, both the tricuspid and bicuspid valve are open, and the atrial systole, both the tricuspid and bicuspid valves are open as the atriums are actively contracting to push blood into the ventricles. The ventricles are in ventricular diastole at this time, meaning they are relaxed. Atrial systole ends and atrial diastole begins. Atrium are relaxed and the ventricles are now hold the maximum blood volume. So here is the maximum blood volume. Ventricular systole is the contractions of the ventricles. The AV valves, meaning the tri and bicuspid valves, close as now the pressure in the ventricles is higher than the pressure in the atriums. The pressure in the ventricles is also higher than the pressure in the pulmonary and aortic arteries, resulting in the semilunar valves opening. As the ventricles contract, blood is pushed into the arteries. Some blood will remain in the ventricles, and as ventricular pressure drops, the semilunar valves will close. Okay. In ventricular diastole, all heart valves are closed and blood begins to passively fill the atrium as they are relaxed. As atrial pressure builds up and becomes higher than the pressure in the ventricles, the AV valves open and passively fill the ventricles. The cardiac cycle and the cardiac conduction system are concurrent with each other, meaning they occur at the same time as the cardiac conduction system provides the necessary electrical impulses that initiate and coordinate the mechanical contraction and relaxation of the heart muscle. I highly recommend combining these two systems into a study tool. You can find examples within the review slides linked in the announcements. Now, the S8 node, located near the superior vena cava in the right atrium initiates the heartbeat. Electrical signals will travel through the atria, sending that signal across to the left atrium and to the AV node, which slows the signal down, allowing for the ventricles to fill and for the atrium to complete atrial systole. Um, this slowed down signal will travel through the AV bundle and the right and left perigingal fibers located in the interventricular septum, where the signal is sped up. Signals travel from the AV bundle to the right and left bundle branches into the perigingal fibers in the papillary muscles. The papillary muscles get the signal first, and contraction stabilizes the AV valves through the chordinae tendineae. Ventricular systole is going to begin in the apex of the heart and progress upwards in a twist motion. The spiral arrangement of the myocytes slightly twist the ventricles during systole. The electrical cardiogram, or EKG, or ECG, is the recording of the electrical activity of the heart. The EKG is something I also recommend you add to your cardiac study tool. P wave is the SAID node firing, resulting in atrial depolarization, the contraction of the atrium. The QRS complex is the AV node firing and ventricular depolarization is occurring, meaning the ventricles are in systole contracting while the atria are repolarizing, or are in diastole, which means they are relaxing. Finally, the T wave is the repolarization of the ventricles. The ventricles are in diastole and are relaxed. Now, there is a section of the review slides where I have added a quick recap of the cardiac output strike volume and EDV, ESV, and ejaculation fractions. This slide right here. Oops. Okay, there are also some practice equations which you just saw right here that and I've also linked practice sheets within the announcements as well. Please give a few of them a try because you will not be allowed a calculator or given the equations for these during the test, so I highly recommend using these to practice. Okay, hormones that influence blood pressure. For now, I'll skip aldosterone as the next slide provides a visual aid for it. We have many ways to increase our blood pressure, but only a few to decrease our blood pressure. ANP is one of the ways in which our body decreases blood pressure by promoting the excretion of sodium, and where sodium goes, so does water, and this water will also be excreted. The blood pressure will widen, the blood vessels will widen, resulting in vasodilation and decrease in blood pressure. Antidiuretic hormone, or ADH, is in high concentrations results in vasoconstriction, leading to the blood vessel narrowing or tightening, increasing blood volume and pressure. For epinephrine and norepinephrine, most blood vessels bind to an alpha androgenic receptor, leading to vasoconstriction and increase in blood pressure. Skeletal and cardiac blood vessels bind to beta androgenic receptors, leading to vasodilation and decrease in blood pressure. Aldosterone is part of RAS and is hormonally regulated, so a decrease in blood pressure is detected by the kidneys, and renin, an enzyme protein produced by the kidneys, is released. Once it makes contact with the liver, angiotensin in the liver will be converted into angiotensin 1 by that renin. Angiotensin 1 becomes angiotensin 2 by the ACE, the angiotensin converting enzyme in the lung capillaries. Angiotensin 2 targets the adrenal cortex into releasing aldosterone. Aldosterone promotes sodium retention by the kidneys, and because water follows sodium, it also promotes water retention, increasing blood volume and pressure. Okay, baroreceptors and blood pressure regulation. Baroreceptors are these specialized nerve endings located on the major arteries and sense when there is a change in blood pressure. Depending on how the blood vessels stretch, baroreceptors send signals to the brainstem, resulting in necessary adjustments to increase or decrease blood volume. These adjustments are slowing down heart rate to decrease blood pressure, increasing heart rate to raise blood pressure, altering the diameter of blood vessels. Vasodilation is the widening of blood vessels, increasing blood pressure, while vasoconstriction is the tightening of blood vessels, decreasing blood pressure. Okay. Now there are different types of blood vessels. This variety in blood vessel types allows for branching, increasing perfusion of tissue, increasing surface area of blood travel pathway, decreasing blood pressure, and aiding in movement of fluids and solutes. Multiple branches of blood vessels allow for more ways in which blood can be delivered to tissues. Remember how I mentioned my grandmother had clogged blood vessels? If she only had one main blood vessel traveling to her foot, she would have been in greater health risk. But due to us having different types of blood vessels, there was still a way for her foot to receive blood. The route of blood circulation it starts from away from the heart to the arteries, to the arterioles, to the arterial capillaries, to the venous capillaries, to the venules, to the veins, and to the heart. Okay, now let's talk about the papillary sphincters. Think of atrial and venous capillaries. The thoroughfare channels travel through the capillary bed without much significant perfusion. It's this bit right here in the middle, this long bit right here. Think of it as the main road, while the capillary bed is connected to while the capillary bed it's connected to are the exit routes, bridges, and the split-off points on a highway. Precapillary sphincters are smooth muscle tissues that is capable of closing something. They control perfusion, Think of how in high traffic hours there is a light directing cars into the highway one by one, so there is a delay of cars loading onto the highway. When closed, as blood flows through the thoroughfare channels, capillary sphincters prevent the flow to other branches. When open, allow circulation of blood vessel through additional capillaries, increasing perfusion. Now, there are some slides I couldn't dive into due to time limitations on my end. But I will be linking Dr. Curley's other SSS review videos so you have access to other study tools. Just because I haven't covered something within this review video does not mean it will not be on the exam or quizzes. You must be sure to review everything within the unit material and use that study guides as your source to gauge your understanding.